A risk factor is a reason why you might have or get something. Here you can see if you have any of the 9 risk factors for insulin resistance. Number 1, a tiny birth weight. When you were born, was your weight very low? If you were born small and early, were you smaller than expected for how early you were? This is sometimes called small for gestational age. 2, exposure to diabetes when your mom was pregnant with you. If she had diabetes just during the pregnancy but not otherwise, it is called gestational diabetes. 3, did you start puberty a little earlier than your friends, or are you simply in puberty? This is a long period of time that starts about when you start to have body odor, or in girls wear a bra, and have a growth spurt. And the hormones of puberty are still active all the way to the age of 18 or 20 years. Number 4, interrupted sleep. By this, I mean snoring, sleep apnea, mouth breathing, irregular sleep, or wake time. Number 5, do you need to take lots of medication to treat inflammatory conditions like asthma, such as prednisone? Other medications that increase insulin resistance are some that treat bad depression, anxiety, or mood swings like Abilify, Seroquel, Risperdal, and others. Or 6, do you have lots of inflammation that is not treated like asthma, severe allergies, many infections, gut disease? 7, is there anyone or more than one person in your family, like a parent, aunt, uncle, or grandparent, who has type 2 diabetes or prediabetes, or PCOS, which stands for polycystic ovarian syndrome, or severe obesity, maybe needing surgery for this? Number 8, have you mostly eaten foods that have added sugars, especially a sugar called high fructose corn syrup? Since the 1970s, it was added to all types of foods in this country that you might buy from a grocery store in packages, wrappers, bottles, boxes, cans. This is called packaged food. Number 9, and last but not least, is there a lot of stress in your life? Stress can affect our hormones a lot. Examples of types of stress include significant anxiety, depression, or mood swings, significant stress that can come from school or college, ongoing and very distressful relationships with friends or classmates, such as bullying, siblings or parents, including being witness to fights in the family, teammates or coaches. Have you experienced loss related to death, divorce? Have you experienced a move or breakup? Living in a pandemic? Or do you live in a neighborhood that is unsafe? Or have you experienced trauma, chronic pain or illness, or discrimination due to race, religion, gender, appearance, size, or identity? These are risk factors for insulin resistance. The more risk factors you have, the more likely you are to have it. Risk factors can change over time. A person without insulin resistance can develop insulin resistance. Also, a person with insulin resistance can develop normal insulin sensitivity. In order to understand insulin resistance, you must know something about food and digestion, and that is up next.